Mohan Srivatsava, MD in General Medicine. I am running my own practice, Arogya Clinic in Visakhapatnam. I have experience of about 7 years as a general medicine. Today we are going to discuss about hypertension, understanding about the hypertension. Actually, hypertension means a high blood pressure. In this, we will be discussing about what is high blood pressure and what are the measures we have to take to prevent it. Okay, generally, we all know that hypertension is increasing the blood pressure, but what does it mean? Actually, what happens is each time when the heart beats, the blood, it pumps the blood into the blood vessels. This creates a pressure against the walls of the blood vessels. The pressure which it's creating, it is called as the blood pressure. Normally, the healthy person, we will see the blood pressures, which is variation in the morning and in the daytime and as well as in the night time. This is a normal variations which we'll see regularly. If the variations are not there, or if the variations are very much high and the blood pressure remains to be in a constant reading for a longer time, then it is called as an hypertension. So the high blood pressure usually develops over a period of time. It can happen because of many causes, mainly because of unhealthy lifestyles, or not having a physical activity, or having the patient, if he's having alcohol, if he's consuming alcohol, if he is smoking, and high amount of stress increases the levels of blood pressures in the body. Normally, the risk factors which we are discussing now here about the blood pressure are quite common. Actually, the blood pressure is a silent killer because there are no major indications, there are no major signs of blood pressure. That's the reason why we fail to see about the we fail to monitor blood pressure. Suddenly, we will get the side effects of the high blood pressure. We indicate the patients who are more than 40 years to get their blood pressures regularly. And the patients who are more than 40 years and those who are having the risk factors. Main risk factors, the age. As the age increases, many people will tend to have increasing in the blood pressure. And if the patient is having a family history of blood pressure, or if the patient is having a family history of heart diseases, then those patients must get regularly checked for their blood pressure. And if the patients are consuming excess amount of salt, they also need to be in a regular monitoring of the blood pressures. And the patients who are consuming alcohol, who are drinking cigarettes, smoking cigarettes, they also need to be frequently checked for their blood pressure monitors. So moving on to the hypertension, as I said before, it is not having major symptoms. The common symptoms which we see in a patient when we diagnose them as having hypertension are, many of them will be having head rolling sensation, some of them will be having lethargy, some of them will be having palpitations, some people will have swelling of the lower limbs, and some people will be having headache in the frontal region and as hospital regions, in the back region. The headache in the hospital region, which is occurring in the back, it is more indicative towards of hypertension, increase in the blood pressure. Hence, if we monitor the blood pressure regularly, and if we get to know what is our basic blood pressure, and if we are under the risk, and if we start using the medications, then we can avoid the complications of hypertension. The complications of hypertension, it can be heart strokes, heart attacks, it can be cardiovascular heart attacks, and also it can be bleeding in the brain and the kidney. Sometimes the kidney also get damaged because of the hypertension. So we have to monitor our blood pressures to avoid these risk factors. And normally our blood pressure is around 120 to 80, which is normal range. Actually, the normal range is around 120 to 140, and that is the systolic blood pressure, as well as 80 to 90. This is the normal range. If a person is having persistent BP monitoring, which is more than 140, and by has to get treated for his hypertension. Now, every year on May 17th, we celebrate a World Hypertension Day. The theme for this year is measure your blood pressures and control it and live longer. This is the theme for this year. The risk factors which we have to be prevent to decrease our blood pressure is we have to do a regular physical activity. At least a physical activity of 20 minutes per day will decrease our blood pressure by 5 to 7%. And healthy diet. Healthy diet indicates reduction in the blood, reduction in the salt. If you reduce the amount of salt which you are consuming daily by 10%, at least by 10%, the BP will be reduced by 5% within a period of 1 to 2 months. And patient must decrease this consumption of trans fatty acids. That means the oil which is repeatedly being used or which is used for 3 to 4 times. This contains more amount of trans fatty acids. But avoid using the trans fatty acids. Consumption of dairy, high fat dairy foods, and consumption of red meat must be reduced. And the people must avoid drinking of alcohol. And the patient must also avoid drinking or smoking. And he must also have a stress management. The stress management mainly comes by meditation or by physical activity or doing yoga. These definitely reduces the stress. And when the stress is reduced, the BP will automatically decrease by 20% in a person. And another thing is the patient must be adherent to his medications, which the doctor has prescribed, and he has to be under the doctor's monitoring for every 2 to 3 months until his blood pressure is reduced, and he has to continue the medication. So if we are able to do these to prevent the blood pressure, to reduce our blood pressure, definitely we will be having we will be having reduced side effects of the blood pressure of high BP. So the final goal is be healthy, avoid smoking, avoid alcohol drinking, do regular physical activity, decrease the consumption of salt, and if possible, do yoga, walking, or regular exercises to maintain a healthy lifestyle. And the another is consumption of high amounts of fruits which are containing potassium that regulates the blood pressure to a great extent. And the patients are also advised to drink good amount of liquid, mostly water or coconut juice, to decrease the blood pressure. At last, I would suggest you that there is nothing more precious than having a fit and healthy lifestyle. Adapting healthy lifestyle can help us to enjoy a long and healthy life. High blood pressure can be prevented and can be controlled in many ways. Keeping the blood pressure in a normal range, we can avoid our cardiovascular complications. And regular monitoring is very much required for the preventive care. Thank you.